This portion of the PowerPoint will discuss the concepts of uncertainty and how they are interrelated. For the concept of uncertainty to exist, there are antecedents that must meet the criteria, and those three antecedents are stimuli frame, cognitive capacity, and structure providers. Stimuli frame is the form, composition, and structure of the stimuli that a person perceives, which are then structured into a cognitive schema. Symptom pattern is the degree to which symptoms occur with sufficient consistency to be perceived as having a pattern or configuration. Event familiarity is the degree to which a situation is habitual or repetitive or contains recognized cues. Event congruence refers to the consistency between the expected and the experienced in illness-related events. Structure providers is the second antecedent. It is defined as the resources available to assist a person in the interpretation of the stimuli frame. Those resources can come in the form of education, social supports, and credible authority. Social supports can be family and how they will respond to the illness. Credible authority consists of providers and their responsiveness and how confident the individual is and how these providers will respond and manage their care. The third concept is cognitive capacity, and that is the information processing abilities of a person, reflecting both innate capabilities and situational constraints. These three antecedents form the concept of uncertainty. The second conceptual component is appraisal of uncertainty. Uncertainty is seen as a neutral state. It remains neutral depending on how the individual interprets the situation. So it can become a positive or a negative. There are two processes that help an individual appraise the degree of uncertainty, and that refers to inference or illusion. Inference is constructed from the individual's personality and can be seen as a positive. Inference determines how the individual will handle and adapt to the situation. Illusion is a belief constructed from uncertainty that considers the favorable aspects of a situation. Depending on how the individual processes uncertainty, it can be considered a danger or an opportunity. Illusion helps uncertainty become viewed as an opportunity. So that can be a positive aspect, having an illusion of the illness or disease that is being experienced. The third theme of uncertainty is coping. As mentioned earlier, the appraisal of the individual, the value that they place on the uncertainty can be considered a danger or an opportunity. Um, but however, either one of those will form a form of adaptation. The individual will either adapt positively or negatively. If uncertainty is appraised as a danger, then coping includes direct action, vigilance, and seeking information for mobilizing strategies. If it affects management, and it affects management using faith, disengagement, and cognitive support. If uncertainty is appraised as an opportunity, coping offers a buffer to maintain the uncertainty.
This slide focuses on how the theory can be applied to nursing practice. The theory of uncertainty in illness highlights how a patient's physiological state can influence their psychological state. Upon further research, peer-reviewed research article Mitchell's Uncertainty in Illness Theory Informing Nursing Diagnosis and Care Planning highlights a need for nurses to address patients with uncertainty with glioblastoma multiforme. GBM patients are at a high risk of uncertainty for their terminal illness. Nurses utilize nursing diagnosis to form care plans with specific interventions to address patient needs. As GBM patients experience uncertainty, their quality of life goes down. The higher the uncertainty, the potential for the lower quality of life. The application to practice will be further broken down based on findings and examples based on evidence-based practice oncology nurses can utilize in their everyday practice in managing uncertainty in glioblastoma multiforme patients. This slide focuses on how the theory can be applied to nursing. GBM patients might experience higher rates of uncertainty due to cognitive changes or rapid memory loss from their brain tumor. An increase in uncertainty can inhibit patient coping, and also uncertainty can be due to the patients having a warped sense of reality. On the right side of the screen, you'll see examples of nursing diagnosis that can be applied to GBM patients. Rankin and Reed's research article highly focused on having interventions to address patients having a lack of understanding or uncertainty that could potentially decrease their ability to cope or adapt to their chronic and terminal diagnosis. Care plans can be generated to help with interventions for these diagnoses to help decrease patients' isolated behaviors due to an increase in knowing. The more knowledge a patient has, the more empowered they can be. Uncertainty can occur with any illness, but especially with patients with terminal illnesses as aggressive as GBM. Nursing diagnoses can directly influence a nurse's practice and how they address uncertainty with their patients.